Well, we're very excited with the Picoway laser because it's the latest technology that the FDA has approved for treatment of tattoos and a variety of pigmented or brown lesions in the skin. Well, what makes the Picoway laser different is that it's a very short pulse duration, meaning that the laser pulse, when it's delivered to the tattoo ink or the pigment granule, it will smash it into smithereens. And this is really high technology. We're so excited about it because it actually reduces the number of treatments that we perform to get rid of tattoos or pigmented lesions to about half that we used to use in the past. What happens when the tattoo is hit by a laser is that the tattoo ink is smashed into smithereens and the body clears away the particles either through the lymph nodes or clearing it out through the top of the skin. What is nice about the Picoway is that it does this most effectively compared to other lasers. What's nice about the Picoway laser is the fact that we can treat all different skin colors as well as tattoo ink colors. And we know that at least half of the tattoo inks that are out there, tattoos that are out there, actually has several different colors of ink embedded in the tattoo design. The benefit for the patient is that the tattoo can be removed faster and in fewer treatment sessions than in the past. Typically, we numb the area with a topical anesthetic cream. Other times, for very large tattoos, we may use an injectable anesthetic so that the patient is very comfortable through the procedure. The time it takes to treat a tattoo varies depending on how big the tattoo is. It can be a minute long for very tiny tattoos, or it can take 30 minutes. Obviously, the longer it takes, the harder it is for patients to endure, which is why some people do request that we give them intralesional or injectable anesthetic. After the procedure, it's very easy. It's very much like when people had the tattoo to begin with. There's just a little bit of crusting. We tell people to keep it covered with a bandage and with ointment. The number of treatments it takes to remove a tattoo very much depends on how long the tattoo has been there. Older tattoos are usually easier to remove because the body has broken down the pigment to a certain degree. Patients who have multicolored tattoos typically need additional treatments just to target different ink colors. The area or size of the tattoo is very important as well because larger tattoos have a lot of ink particles in there. So tiny tattoos may only take about 2 to 4 laser treatments. Larger tattoos may need 10 or more. It really just depends on the size, the location, and the age of the tattoo. Patients often ask me whether getting rid of the tattoo hurts. Well, it certainly doesn't hurt any more than getting the tattoo. It actually feels very much the same, but we mitigate or we alleviate the intensity of the laser by using either a topical anesthetic cream or injecting some lidocaine so that people don't feel the laser. I prefer that patients wait at least a month, if not longer, between each of the laser treatments. And the reason for that is it gives the body enough chance to clear away the tattoo pigment granules that have been broken down by the previous laser treatment. The price of laser tattoo removal very much depends on the size of the tattoo. It can start about $250 to $300 per treatment session and go upwards from there. Very large tattoos will typically cost about $1,000 per treatment. Tattoos are very popular. In fact, in the United States, it's reported that over 50% of the U.S. population actually has more than one tattoo. That's quite a large number. Research has shown that most people who end up having a tattoo will end up regretting it at some point in their lives. And that's why laser tattoo removal is so important. It's very important that you end up going to a board-certified dermatologist or another physician with a lot of experience in removal of the tattoo with lasers. Unfortunately, I have seen quite a few people come to my office after having been scarred by other practitioners, and I'm not sure where these lasers are being used.